about here. So this is what we're going to try and do over the course of the next little while. I'm going to keep standing over here so the folks on live stream can see me. We're going to try and think about what are the key leadership behaviours that really raise the engagement of staff and create joy in work. We're going to look at some of the changes that we can make in our system that might help us to get to joy. And we want you to take away at least one intervention that you are going to try out in your system when you get back. And so this is the way the session is going to work. I'm going to cover what do we mean when we talk about joy, and ask you to do some reflection on what brings you joy. Amar, Shah will join us. Amar is going to talk about some practical lessons from East London Foundation Trust in terms of raising levels of staff engagement. And then Jessica Perlo, who's IHI's director and who leads our Joy in Work portfolio, is going to share with you some of what we're learning so far in working with some systems on joy in work. So when we talk about joy, what do we mean? So firstly, I think it's important for me to say that we've been very deliberate in talking about joy in work. We believe that the healthcare workforce across the world deserves joy in their work. We got into this by talking about reducing burnout and sometimes about creating resilience, both of which are really important. But we very deliberately wanted to flip the paradigm and talk in an assets-based way about joy. It's not a new thing. One of the real founders of the science of improvement talked 40 years ago about how people are entitled to joy in work, and how that one of the functions of management and leadership is to create an environment, a system where people can take joy in their work. So we haven't invented this phrase. It's been at the very heart of quality improvement for quite a long time. And it's been part of IHI's mission for a long time. We have engraved on the wall this phrase about what IHI does: improve the lives of patients, the health of communities, and the joy of the healthcare workforce. But what we haven't had really is a set of changes that we could work with our partners to deliver that would enable us to get to that state. And that's what we want to share with you over the course of the next 55 minutes or so. So there is a burning platform. This is data from the United States, but we find these kinds of issues everywhere that we go. High levels of depression in our clinical workforce, people feeling exhausted, having symptoms of things like post-traumatic stress disorder, and a rate of suicide amongst our physicians that's twice that of the general population. It's a real challenge. Here's some of the additional data. So we see rates of burnout at double that we might expect in comparative organizations. If this was a public health issue, if we were talking here about this level of prevalence of a community-oriented condition, we would call this an epidemic. And I think part of our argument is that the absence of joy and the filling of that gap with burnout is a public health issue. And it's something that we really, really need to tackle. And so, as I said, just as Antonovsky described the fact that health is more than the absence of disease, we believe, too, that joy is more than simply the absence of burnout. And indeed, we've adapted some of Antonovsky's long-standing and highly regarded social science as part of our thinking around how might we create joy, particularly that section in the quote there where he talks about this idea of creating a sense of coherence, a sense that life is comprehensible, manageable, and meaningful. And I'll return to that just in a moment when I describe our framework. So at the very heart of what we're recommending that systems do, the fundamentals, if you like, the three things which our early work suggests to us that if we do not tackle, it makes all of the rest of the work we need to do so much more difficult, are these three things. This idea of giving people a sense of control over their lives, that sense of coherence that Antonovsky talked about. The importance of people feeling connected to purpose, that they are doing work that is meaningful to them, that engages them emotionally as well as rationally. And the idea that we have to create camaraderie, high-functioning teams that are built on trust and mutual respect. These are core to our theory about how we're going to secure joy in work. So let's just unpack those a little bit. So here's this sense of coherence thing. And Antonovsky did this study amongst people who were incredibly stressed. Much of his research was based on survivors of concentration camps, so people who had been through almost the most stressful experience you could possibly imagine. And what he found was that in spite of that, some people thrived. They went on to achieve remarkable things despite those stresses in their lives. And the things that those people had in common lay in this sense of coherence. They saw life as structured and predictable. What they were doing made sense to them, and I think this applies to our healthcare workforce too. If what we're asking our staff to do feels comprehensible to them, feels that it makes sense to them, I understand why I'm doing what you're asking me to do, then our chances of success are much higher. If our staff then feel as if they have the supports that they need in order to do that, that they find the work manageable, then again our chances of creating joy are much enhanced. And third, if they feel a sense of meaning and purpose, if it fits with their sense of why they do what they do, it's worth it to them, it engages them, again we have a higher chance of success. The idea of constancy of purpose, again, is not a new one. In a lot of Deming's work, he talks about the absence of constancy of purpose as one of the deadly diseases of management. There's a fantastic article by Don where he talks about what really motivates people, what is it that really creates that intrinsic motivation in people who work in healthcare. And he ascribes that to connection to purpose. And then there's this piece that's about trust and camaraderie. That the only way, the foundation for high-performing teams lies in creating this foundation of trust. Because only if we have trust can we work through some of the inevitable conflicts. Only if we're able to do that can we commit to decisions that we share and hold ourselves each other accountable in a respectful kind of way. And so where that feeling of mutual trust exists, we find camaraderie. So a sense of coherence, the constancy of purpose, and the creation of trust and camaraderie in high-performing teams are at the very essence of what we're trying to create as we create joy in work. So how do we get from where we are, from burnout that's at epidemic proportions, to joy in work? People often describe that to me as a chasm. It just seems like such a distance from current state to future state. How can we bridge that? So we believe we can start to build that in 4 steps. And step 1, if you've been paying any attention at all over the last couple of days, will be familiar to you. So just as we're seeing real and tangible benefits in asking our patients what matters to them, so too, as we've been prototyping this work at IHI, have we been seeing real benefits in opening the conversation with staff about burnout and joy with that simple question about what matters to them. Because we can use that question to open the dialogue and start to uncover what people sometimes call the pebbles in their shoes. So what are the things that are the impediments to joy? And again, what we found is those are very contextually sensitive. They're very local. I'm sure many of you will recognize this, that we find in our own systems, and often in neighboring units or wards, teams that are highly engaged and productive and feel a sense of meaning, and at the same, in the next ward over, teams that are disheartened and feel disconnected from what brought them into healthcare. The pebbles are very locally and contextually sensitive and need that one-to-one conversation about what really matters to the individuals and to the teams that work in those units. So once we've done that, once we've had the dialogue, then we can commit to making joy in work a shared responsibility. It has to be grown from the conversation up rather than imposed from the boardroom down. With that shared commitment, we can start to use the tools and the methods that we're all familiar with, founded in improvement science, to start to test changes, to create theories that will lead to improvement and to achieve measurable results. And Amar will talk about some of that in his section. The results of that are not just reduced burnout and higher levels of staff engagement, but there's a very, very strong correlation between high levels of staff engagement and high levels of patient engagement. There are many studies that demonstrate that those two things are closely interrelated. That if we can achieve higher levels of engagement in our staff, if we can create joy in the healthcare workforce, we'll get better patient outcomes. So where might these things that we might test lie? Where might we find some ideas that we could test is the next phase of this. So we've asked our questions. We've had the what matters to you comment. We've started to understand what are the unique impediments. And so now we're looking for where are our change ideas? What are some of the drivers of joy in work that we can start to apply? And so you can see here those 3 foundational pieces that I talked about. The idea that camaraderie and teamwork is important, that we have to go about creating meaning and purpose, and that we have to give people control and a sense of coherence over their daily lives. And you can see that we're attributing that meaning and purpose and autonomy and control work mainly to leadership. So we've got these 3 levels of activities that are primarily driven by senior leaders in the dark blue section. Work that managers and core leaders can make a key contribution to, and then stuff that's for individuals. And so we start to build the framework on those 3 levels. That's why it looks a bit like this interlocking wheel. So the other things that we're asking the senior leaders in the room to be thinking about is, how can we create an environment where people feel safe? Not just physically safe, but psychologically safe. How can we create a system where people feel fairness and equity? Because one of the things that we've found as we've been doing our research and our early work is that joy is not evenly distributed across our organizations. And the people of color in our organizations, for example, often are more challenged than others around finding joy in work. And so taken together, you can see those 4 things that we're inviting senior leaders to take a particular responsibility for. They're responsible for everything on the wheel, but these are the things that they can uniquely influence. Along with creating camaraderie and teamwork at the local team level, the managers and the core leaders need to create this sense of participation. That joy in work is a shared endeavor. It's a team sport, not an individual one. And then there are some things that we as individuals can do. We can get involved in the daily improvement that results from steps 1 and 2 and 3. So, you know, we've had the dialogue, we've understood the pebbles in our shoes, we've made the shared commitment. Then we need to get people involved in the work. And we can all do that. We can all pay some attention to our own wellness and resilience. That's not to say that joy in work is all down to each and every one of us. There's no personal blame or shame attached to feeling burnout. We all feel it from time to time. But there are some things that we can do to minimize the impacts of that. And we can all contribute to real-time measurement. One of the things that has bedeviled our progress around this is that we rely on annual staff surveys to tell us the current state of joy in work in our systems, and that's just not enough. They tend to be poorly participated in, and they do not give us useful information for improvement. And so we need to find other ways of measuring our success. So those 4 steps give us a way to bridge from burnout to joy, and this wheel of action gives us some of the interventions that we might want to take. And here's how it all fits together. If anybody's been waiting for the one slide that will give you the full thing so you can take your picture of it, this is it now. I'll leave it there for a little while. So what we'd like you to do for the next 2 minutes is just turn to the person next to you and have a conversation about what brings you joy in your work. And maybe it has its foundations in some of the things that we've talked about, and maybe it hasn't. So just have that conversation for 2 minutes about what brings you joy.
So what brings you joy? It's a really important question. What brings me joy is seeing how my work connects to something that matters to someone we're trying to serve. So that connection and meaning to the end user is what brings me joy. So I have changed the way I work every week to make sure that I have a way to connect with that every week. But what brings you joy is a really, really good question and a way into this conversation with your staff. So I hope that's been a helpful little discussion. What I want to do is share with you now, having heard from Derek about some of the theory and the framework that IHI has developed, I want you to hear a little now about how one organization has tried to apply this theory in practice. We do not have, by any stretch, the answers to this. I'm just trying to present some of our journey over the last decade in trying to work at improving the experience and engagement and joy of our workforce. So I'll talk you through a little bit about our work, and then hopefully that will stimulate some thoughts and some ideas which you may want to take away. A little bit first about who we are. So I'm going to give you the story of an organization, a relatively small organization, that started in the East End of London. So for those of you who have been to London, we started out in the very eastern part of London, which actually ranges from the financial district, which is hugely transient population, but very wealthy, through to Tower Hamlets, which has some of the highest child poverty and the lowest white population of any borough in England, out to Newham, where the XL Stadium is, which is where the Forum has been held before. And that has the highest migration into the borough of any part of England. So we started out in a hugely diverse population, providing mental health care. And now we provide mental health and community health to most of these populations. We also provide some more specialist services to a wider part of northeast London. We have some satellite services dotted around London. And for the last nearly 3 years now, we've been completely out of London in a different population in Bedfordshire and Luton, more rural, more wealthy, more dispersed, very different context for our work. So over the last decade, one of our primary objectives as an organization has been to improve experience of staff. And this was way before we ever heard about Deming or heard about joy. And some of the ways that we've been trying to support this have been through these aspects here. So we have really tried to support clinical leadership in our organization, to try and make sure that the way that we run the organization is as grounded to clinical practice and the thoughts and ideas of our clinical workforce as possible. So our chief executive has been a doctor for the last 10 years. We really tried to support clinicians to lead every part of our organization. We've also tried as much as we can to be as accessible as a leadership team. So we currently run between 20 to 30 leadership walk-rounds every month to listen, to go out to every part of our organization using a standard format to listen to what people feel about working in their service and in the organization, about the things that work well, that they're proud about, but also the things that we could do better at. The third element is really key for us. It's about how do we improve the way that we work in partnership with those that we serve, what we call people participation. And over a decade now, we have built structures and processes to really help us as an organization run it in partnership with our patients, the people in the community who we serve. So they are part with us when we're thinking about what's working well, what's not working so well, and what can we do to improve. And we try and do that in partnership through every aspect of the way we run our organization. We've also tried very hard to be as inclusive and diverse as an organization as we can, to reflect the communities we serve, and to support people to lead wherever they are in the organization. Another key element that we've really worked at for many, many years is to give teams space. Critical in improvement is to have space to reflect. Think about how you're doing. So every team has an away day. Every 6 weeks or every 8 weeks, every team will take some time out of their clinical workplace to think about how they're doing, to look after themselves, and to plan for the future. And then 5 years ago, we came upon quality improvement, and we began our quality improvement journey. And we recognized at that point that we couldn't really solve our most complex problems. We couldn't get to the next level of performance without a new way to think, a new mental model. And so we began really understanding and learning about how to use quality improvement across everything that the organization does. So we began to really flip the power balance, give people permission to make changes in their workplace. We gave people skills around how to understand the complex system around them and make changes to it and see what happened. And we really did, as a leadership team, bang the constant drumbeat of quality improvement to give people that confidence that they can make a difference. We brought people together in learning communities to connect where they may never have come together before. We've brought people together around shared purpose in their teams and also aligned it towards the organization's mission. And we know that there's a growing degree of belief that the use of quality improvement alone can improve staff engagement. And that's what we saw. We did expect some improvement in staff experience, but over the last 4 years, we've been surprised by quite how profound that has been. So you can see us here as the red dot on our annual staff survey in the NHS compared to every other healthcare provider in England. And it has got better over time. It is not yet where we want it to be, but on some of these questions, we're now at the upper end of all healthcare providers in England. So we've seen an impact on the experience of people working in our organization through using quality improvement. Now, the quality improvement work is not targeted at joy. It's targeted at the things that matter most to the patients, the population, the staff coming together and thinking about what is their common shared challenge in their service and what can they do to discover a better solution. But the use of improvement, the power flipping in the teams, has had an impact on staff experience. And yet, there is variation. So if you look across our organization to the different areas, there's variation in how people feel, in how engaged they are. If you look across disciplines, there's still variation. And so 2 years ago, we came upon the Joy in Work framework that the IHI was proposing. And we thought this might be a way for us to continue working on this and to work at the variation that existed. And so we then began using the IHI's framework around joy in work to help think about how to progress and move to the next stage. The very first thing we did was to think about how do we make this work feel meaningful to our staff. When we started talking about joy in work, it didn't go down so well. The word joy provoked a reaction, an immediate reaction amongst some people. And the use of language in improvement is really important. We have to make sure that our improvement work is meaningful to people. So that we started out by running some surveys and focus groups to say what words would be meaningful to you. If we were to think about your experience at work, what words would be most useful in helping us understand that? And so we came up with, instead of thinking about joy in work, we called it enjoying work, which seemed to resonate better with our staff. The next step we took was to say, what contributes to us enjoying work? We started to build our theory of change, again by involving a wide range of people from different kinds of services to say, what do we think contributes to us enjoying our work? And what would someone else notice in our behaviors if we were enjoying work? And so we built our driver diagram from all of the people's thoughts about what contributed to us enjoying work. And you can see the driver diagram here. I mean, the 4 primary drivers are teamwork, trust, embracing new ways of working, and connection to meaning. Now, underneath each of those secondary drivers lies a whole series of change ideas that have come up from the teams, but this is our global theory of change that supports each of our teams doing this work. And then we found some prototype teams, some teams that were willing to get going with it. And we said, okay, how would we measure this? Derek's challenge about how do we get real-time measurement to help us understand and be agile and think about what we can do differently. And so we again tested. We tested a few different outcome measures about how would we know, what would we measure to know whether we were enjoying work. And we landed on this phrase: did you have a good day at work? Mostly yes, mostly no. And we tested through a series of PDSAs, and that seemed to resonate and be meaningful. So our prototype teams then went and started asking that question every day to their staff. And they tested that measurement in a number of different ways, from a very simple 2 boxes on the way out of work, and you dropped a pebble in one of those 2 boxes, to a survey, to an app. We had different ways of measuring being tested in the organization. And the team started making changes. As they started understanding the variation that existed and they built their theory of change, they started trying out new ways of working, trying new change ideas and testing them out. And critical to this was about making it transparent so that everybody could see what was being done. So here's one service in Luton where they did a very simple thing. They put up on the board what we heard and what we've done about it. And you can see on here, some of these are very simple things that have been done in response to helping people really enjoy their work. Here's another team that's been working on this, and they have a slightly different way of making this transparent. A Kanban board, where we can see all the ideas that are in the pipeline, the things that we're going to test next, the PDSAs in progress, and the ideas that have been tested and now been implemented. And you can also see the data, which is up for everyone to see in the team. So as these teams learn together, core to that learning system is about measurement. So each of these teams comes together every 6 weeks to learn from each other, to see what each other's testing, to share ideas. And here's the measurement system, the dashboard that they can all see about the variation that's existing across the teams that are testing. So when I reflect back on what we've learned over the last year of trying this in our prototype teams, I'm thinking now about the sequence of improvement that all of our teams go through when they do quality improvement work, which always starts off with working out what are we going to focus on, identifying the quality issue. And for us, in tackling joy in work, critical to that first step is the commitment that people make to this from managers and senior leaders. If you remember the joy wheel, there are three levels to that. So there's individual commitment, manager's commitment, so the team manager commitment, and senior leader commitment. And that is really important in this first step. Because as people start to explore what matters to them, they start to identify the pebbles in the shoe. That's can be a challenging process. It can unearth some difficult things and some tricky emotions to manage. And so we need to make sure that leadership and management are committed from the very start to doing something about that. So we also want to work with the willing. So we encourage teams to volunteer for this. We want this to be something that pulls people towards the work. The second step is really what the IHI framework talks about in terms of asking the question of what matters. We used an appreciative inquiry approach to really start by recognizing the strengths and assets that existed in the team, helping people recognize what contributes to a good day. What does a good day feel like? What are the strengths we have in this team? And then thinking about, well, what are the things that get in the way? What are the pebbles in the shoe? And in this phase, we're also collecting data daily. Now, daily data collection might feel like a chore, but it's really for the purpose of understanding the variation that exists. Because people feel differently, and the teams function differently from day to day. And it's important to understand that, to know how to intervene best. The third step is around creating your strategy and your change ideas. And this, although we have a global driver diagram, each team develops their own change theory. Every team functions differently. And so every team is likely to have a slightly different theory about how are they going to enhance people's experience at work so that they can enjoy their work more. So every team generates their change ideas and creates their own driver diagram, and then joins the trust-wide learning system that we've created so that teams can learn from each other. And then it's very simple. We use the model for improvement to set a name and use PDSA cycles to test the change ideas one by one and collect data, qualitative and quantitative data, to see what works, what needs tweaking, and what doesn't work and can be abandoned. And core to this bit is making the work transparent. So this building of psychological safety is really important in helping teams believe that something can change. And so transparency around the data and what we're doing about the data is really helpful in supporting that. And then finally, the ideas that you've found to work, you have to make business as usual. So we then move into the implementation phase of making those the new way the team works, again, using PDSA. So in coming back to the 4 steps that Derek showed to us, I think we've largely used a similar process. The only difference, I think, has been that we go to step 3 first. We really make sure that as teams volunteer, that senior leaders are completely committed. So enjoying work is one of our trust-wide priorities. And that's important because it shows the senior leadership really care about this as one of the biggest priorities for the whole organization. But team managers also have to commit to this. Teams wanting to do this work, or individuals wanting to do this work without their team manager being truly committed to it, is unlikely to succeed because the team needs to change the way it functions. And then we go into the appreciative inquiry, what matters to you, identify the pebbles, and use improvement science to make changes. So the next phase for us is to scale up. We've seen 3 teams already from our prototypes see an improvement in their proportion of people who are enjoying work. And our next step is to scale this up. So we have 30 teams now ready to move into the next phase of this work. We're building a learning system around them, so they'll come together and learn. And they'll have support from improvement coaches and organizational development to support them as they go through the next few months. And key to scaling up is also measurement. So how do we do measurement at scale here when we're talking about moving from a handful of teams to now 30 teams? So we've developed an app which allows teams from their phone to be prompted at the end of a day or end of a shift to answer that very simple question. Have you had a good day? Mostly yes, mostly no. And then 5 words to describe why. And so that app will help each of our teams now put in their data, but also see their data in real time on a daily basis. So people can see their own data and their team's data about how they're feeling. And they can contribute their ideas through it. So when in your daily work you spot an idea that might make a difference to how the team feels, you can put it in through the app and everyone can see how you're working on this. So in the last section, in summary, if I was going to propose how others might undertake this journey, I would say the very first step is just to use quality improvement in your organization, because that has had a tremendous effect on how people feel in our organization, about the confidence they have, the ability to make improvements, the control they feel over the system, and the connection to purpose. And if you do that really well with your multidisciplinary teams working together, and you do it in partnership with your patients and service users, that can have a profound effect on how people feel at work. If you wanted to use improvement to now directly target joy in your workforce, I'm going to just use the 5 components for design of improvement to think about how you might do this. So start with an aim and co-produce that. So for us, we ended up with the aim of improving staff satisfaction and well-being so that staff are better able to meet the needs of their service users. That bit was really important for our staff to recognize that they were doing this so that they could give back to their service users. In terms of your content theory, create this together again. Explore theories with your staff. What is it that will contribute to a day where people feel joyful? Use appreciative inquiry. Ask the what matters to you question. Find out the pebbles in the shoe, but involve as many people as you can and create a driver diagram to bring your team's theory together. With the execution, use improvement science. Use the method we know and love to test and learn as you go. And the key thing here is to get into testing as soon as you can. One of the risks of this that we found is that you can get stuck in cycles of asking and really learning about what matters and what are the pebbles in the shoe without really doing anything about it. So we want to understand in order to improve. So start the questions, build the theory, and get into testing, because you'll learn much more about how your complex system functions and how it might be improved by testing ideas as quickly as you can. Get into measurement. Co-design the questions you're going to ask with your team so it's meaningful. Use words that really resonate. And keep the data collection as simple as you can. This work is not about collecting data. It's about improving experience. So use the data sparingly to help you improve. and make your data as transparent as you can. And finally, communicate and disseminate. This work is difficult work. Lots of teams are likely to be skeptical at the beginning that anything can really change. So capture the stories, share the learning, and communicate as regularly as you can to your senior sponsors so they build a degree of belief that this can really make a difference. So that's the learning from East London. I'm now going to hand over to Jess.
All right. Hi, everyone. In 2015 and 2016, Derek asked us to make this a strategic priority at IHI. So my colleague, Julie Landsman, who's also here, and I led 3 innovation cycles, 90-day research projects, intending to create that system for improving joy in work that Derek and Amar talked about. We knew that oftentimes so much of the burden for joy in work gets put on individuals, and you hear this all the time. Subsidies for gym memberships or wellness programs, they're all well-intentioned and they're great, but we're a systems organization, and what we wanted to give folks was a systems approach to improving joy. So the first cycle focused on how are people talking about this. We just went through all of the literature and wanted to find out how are people measuring it, where are their bright spots. We came up with this recommended reading list, which you can download for free on IHI.org. And then we identified from within that research, where are their experts? Where are their bright spots? Many of them weren't in healthcare. Some of them were, like Mayo Clinic and Brigham and Women's Hospital. They're doing really great work. But some were outside of healthcare, like Melno Innovations and Starbucks. It was funny because when we interviewed Howard Baer, the former CEO of Starbucks, he talked about quality improvement. He talked about testing things in one store and then scaling it up to more. But what we found from them were changes that we could then test through prototyping. So our last cycle, we got 11 organizations inside and outside of hospitals, organizations, academic institutions, to test some of the changes we'd found to see if they resulted in an improvement. IHI was also one of the places that tested. The majority of them elected to focus first on meaning and purpose, recognition and rewards, and camaraderie and teamwork. I'm going to give you just a few examples just to see if any of these resonate for you and if you might want to take them home with you. The first comes from Nemours Pediatric Intensive Care Unit in Delaware in the US. They wanted to focus on anonymously identifying what were the pebbles in the shoes of their staff. So they did a GER board. They put this board up in the hallway. They asked people just anonymously share what's getting in the way of a good day. And they got over 100 responses that they then categorized into 4 different areas for improvement projects. So they got to step 4 pretty quickly. Mount Auburn Hospital, which was right down the street from us, they came to us, and we actually went there physically, and met with their chief nursing officer, their VP of quality. They were really, really intentional about this because they were about to roll out electronic health records, and they wanted to make sure. They knew that this had resulted in a lot of issues for folks, which I'm sure you can relate to. So we encouraged them to start with 1 unit, and they identified their labor and delivery floor, and started with their leadership. So they did a leadership self-assessment, and they found out that actually it wasn't just a self-assessment, they had the staff assess leadership, that there was an issue with communication. So they did this board. They just put up, here's what we're working on, here's what we're hearing. They worked on nonviolent communication training, which is Marshall Rosenberg's work. And so this transparency kind of helped them to start to work on communication and ongoing trainings. The University of Virginia School of Nursing, in their annual Gallup survey, they knew that they had a problem with wage and part-time staff. They had lower scores for satisfaction. And so they went and talked to them. They asked, what matters to you? Why is this? And they found out that people didn't feel respected during their time off. And so they asked, what could we test? And so they just delayed emails that would be sent over the weekend to the following week. That worked so well, and people were so happy with that, that they've now scaled that across the university. And they also, it gave them a space for people to say, okay, we're being heard, and let's start to work on some of the other issues we're having around communication and transparency and interprofessionalism. Imperial College is one of my favorites, and actually Bob Klaver's here at the forum, so is Sarah Jassam. It should be no surprise they used a community organizing approach to this work because that's very much what they've been talking about here at the forum. But one of the things they did is they realized they didn't want to make assumptions about what made for a good day with their colleagues. So they did speed dating. They sat down with folks and just asked really quickly what makes for a good day for you. And they were very intentional about focusing on bright spots. So it was an asset-based approach. And they used appreciative inquiry. Okay, what's getting in the way of that? Which helped them to do some improvement projects and to link this with other safety efforts going forward. So you might be wondering what tests you should try, and of course that's going to depend on your local conversations and what matters to you. But here are some ideas. Now, as Derek and Amar shared, these are usually going to fall into some broad categories. We hear a lot of times that the drivers of burnout have to do with efficiency and workload issues, safety, physical and psychological safety, and camaraderie and teamwork. So here are a few ideas. People have found that using medical assistants or other team members to do some documentation helps relieve that burden. So getting people doing what they love the most in front of patients and doing less paperwork. At the Beth Israel, they do violence prevention training to help with safety. There's peer support training to help people dealing with adverse events. Our Leadership Alliance here in Europe and also in the US, they did Break the Rules, where staff are allowed to break rules in service of patient safety for a week at a time. And then they look at what are those things, because they're probably inefficient rules or processes. Other places offer courses on storytelling and listening. We often assume that these things are just leadership skills people have already. Oftentimes they need to be taught. And finally, collaboration hallways. Just physically getting team members next to each other. They did this at the University of Minnesota so that a surgeon could walk across the hall and talk to an internal medicine resident about a shared patient, co-locating people so that they can co-create solutions. So there's been some themes in this work that have come up through testing and through some of what we've heard from folks that we would just want to get out of the way, some lessons learned. First and foremost, we oftentimes need to do some myth busting. There's a lot of old thinking about what it takes to improve joy in work. First of all, we're not talking about salary and benefits. That's important, but it's good hygiene. It needs to exist, but it's not going to motivate good behavior or satisfaction, rather. It's not just an HR issue. It needs to be team and leaders at all levels. And that staff satisfaction leads to lower turnover. It does, it definitely does. But it's about triple aim results. We're talking about happier patients and greater productivity. And staff want more than just salary and benefits. They want meaning and purpose and camaraderie and equity. And it's the job of everyone. There's also the work before the work. I was talking to one of my colleagues earlier this week, and she said, I'm not about to assess all of my staff again. People are really tired of this. And sometimes that's because we're not really doing anything with what we're finding out. So there's some preparation that needs to happen before we can start to make inroads. First, assure that you have the capacity for this work, just a champion, someone that can help drive this. And thinking about what am I going to do with the things that come up. It's about doing with and not for, so that's kind of a shift in the way we usually approach problems. Identifying a champion, as I mentioned, and then including all staff, all stakeholders at the beginning so that they can see the problem and help design the solutions. The language matters. So I know a lot of people in here don't like the phrase joy in work, or maybe you do, which is great. We do because it harkens back to Dr. Deming. But trust me, no one gets this more than someone whose title is Director of Joy in Work, that there are some days it just feels ironic. But this is the work we're doing, and we should feel joyful doing it. So just choose a word that works. Choose whatever works for your staff. The National Academy of Medicine uses well-being, and that's what they're focusing on, so make it work for you. Measurement is key. Sometimes people make the work all about measurement, and that's not what we're trying to do. But just use what you've already got. You probably have some staff satisfaction data, but supplementing this, Amar got into this a lot more. Best practice is to make sure that everyone has a chance to voice or communicate their opinion, so some sort of assessment that gets to all staff, and just supplementing that usually with some more real-time feedback so that you have some sort of gauge more frequently about if things are working. And don't reinvent the wheel. There are lots of assessment tools out there. Press Ganey already has one that people use a lot. We hear a lot the Maslach burnout inventory is used. Any assessments that you already have, continue to use, but if you're stuck, we came up with a prototype testing survey. I see people taking pictures of this. This is also available for free in our white paper, which is on IHI.org. So this is in the back of that. And we're also working on an organizational assessment, a diagnostic tool. We're working on validating this right now to make sure that it actually correlates with metrics that matter to you, like turnover and safety event reporting and suicide and depression rates and things like that. But this will be available soon. We're going to save some time to be available to you for questions after the session, but we'll also put up our emails just in case you have any lingering questions. You can get in touch after the session. But we want to ask you, can you commit to starting one conversation around what matters with your colleagues and staff, that you test a change to remove these impediments to joy in the next quarter, and finally, that after doing this, you reassess opportunities for interventions at the system level. And for our part, we want to make a commitment to continue to disseminate what we're learning. So we have this free white paper. Please go ahead and download it. It's the white paper, the IHI framework for joy in work. But we also have programs and opportunities at our other forums. I know everyone here is already going to Glasgow, but if you feel like coming over to the States in December, we'll have a whole track on joy in work at our national forum in Orlando. And we have a program. So this is a virtual program that's been running. Its first offering is actually right now. It's a 12-week course that's semi-synchronous. So there's video lectures of all of the great faculty you've heard from this week. But there's also some work that you can bring home to your teams, and then there's calls so you can learn from the global community that's doing it. It will be offered again in the fall, and we hope to be able to continue to offer it just to help give some resource out there to all the teams across the globe who are working on this. So that's it. Thank you so much.